Morning, today is March 3rd, 2026, this Tuesday. Present with us right now from the Health Department is Pam Hanna. Pam, do you want to lead us off, please?
All right, thank you. Well, we were gathering some data on for our public health snapshot that we do monthly, and Tana gave me the flu numbers, and I went, oh, so February is our shortest month, and we had 50% or more of our flu cases come in February. So we've hit a spike with flu, obviously. A majority of those flu cases have been from the B strain, which typically impacts children more than adults. And it is, we're seeing our younger population with influenza and higher rates than anyone else. We've had a total of 4 hospitalizations from October 1st until now for influenza. We have seen a decrease in vaccination rates for our younger population as well. So some people have been concerned that maybe the vaccine didn't match very well this year. It changes every year to match the strain. But from what I've read, the A strain didn't match great, but the B did. The B's right on. So we just need to vaccinate. So that's our big thing. COVID has slowed down a little from what we were seeing. We're seeing fewer cases of COVID. We had 1 case of RSV in a child that was reported to us. Our long-term care facilities have been well. We haven't had an outbreak. And I want to knock on wood or something because we haven't had an outbreak in quite some time. And none this calendar year. Our schools were impacted by the flu last month, but we're seeing better attendance now, and it looks like the kids are healing and getting back to school. So the daycares didn't report that it impacted them. So good. That's what we're seeing with illness around and about. We are still kind of trying to work out some of the kinks with environmental health and how to make sure we have all the things we need and are providing those resources. Molly is going to be gone next week, and so we're trying to make sure we've got our ducks in a row for the rest of us so that we can handle some of that while she's gone. So one thing that happened this week that Molly reported to me, she and I have a report out every Monday, and we do talk about the environmental health side as well. And one thing that she reported to me is that the contractor had come in looking for some files and they didn't know where they were. So some of the files are in our office, which my office is as full to the gills as we get. Some of them are in the treasurer's office downstairs where the sanitarian was, and some of them are still in the Paradise building in the workroom. And there are files also in that shed at the Paradise building. So I know that nobody's using the treasurer's office room now, but I'm wondering if it would be possible to put the 3 or 4 file cabinets that are in the Paradise building into that room so that when somebody needs them with 2 options instead of 4 where everything is. And I'm also concerned that if that room is used for something else, that those file cabinets will go somewhere else and we won't have them.
We're working on that.
I don't know what your thoughts are.
Megan's gonna come over tomorrow, and with Pat and I, we're gonna figure it all out. And I think we're gonna try to get everything in the Paradise building, get everything out of that office into the Paradise building, get it out of storage, get it in the Paradise building, so Megan can actually organize it to where if you have your contractor or our contractor come in, everything's right there.
Okay.
So Megan, but we've got lots of room in the Paradise building. We don't have to worry about floods or anything else over there. It's all.
And will we be able to lock that door and secure that room?
You know, it should be able to be secured, and so everything will either be in your office or in that little.
That would be preferable.
Yep.
Just not to have it all over the place.
I know.
And then my question then is, can Molly be involved in that, or can she come in when all that's done so that somebody can show her where all of those files
Oh,
are?
absolutely, yeah.
Because she's the one who's directing the rest of us to,
'Cause I think Molly was helping Megan get in down in the basement.
They
there
did.
Friday,
They were
so
trying
I'm
to
assuming
figure out-
Megan and Molly are communicating
course they
somewhat,
are.
so as soon
Yeah.
as soon as we get it figured out, then hopefully Megan.
yeah, if we can just be looped in, that would be good. Like I said, just efficiency for everybody so that we can
Yep.
find what we need and know where it's at.
Yeah, that was kind of a rough transmission or transition with Matt, because it kind of went over to your
Right.
office and kind of went down to his office,
Right.
but half of it was still there and half of it was still
I
in store.
know.
So now we're just gonna get it all together, get it organized and.
And I don't even know what's in the shed.
Yeah, I don't know either.
We used
Megan
to
was going through
have
it
some
all.
of hazard waste kits so that in there. We moved those into our blue sheds so that we knew where they were.
Mhm.
So those are in our sheds, but so I don't know what's in that environmental shed.
Okay.
But I don't, and yeah, that would be great. That would take some stress off from me if I.
Yep.
Could feel that. Okay.
Yeah, so Megan and I and Pat are gonna try to get everything organized in one spot, which should be in the Paradise. Behind a locked door.
That'll be good.
Yep.
That'll be good. So as spring approaches, we're kind of starting to plan for some trainings for our staff. In April, it's traditional that we do an immunization training that DPHHS's immunization team provides. We go to Fairmont for that, and it'll be April 23rd this year. So it will be all of the nursing and Molly, and then Jesse keeps our clinic open that day for us. And then there used to be a summer institute training that we would do in the summer, and then there was usually a spring training that public health did in April. They've decided to combine that into one training in April. It'll be in Billings the week of the 13th, 14th, and 15th. It's the changes they've made have made it a pretty pricey conference. And I've talked to my staff, and I might be the only one going to that. The others didn't feel enough interest in it. So what I asked them to do is to choose a training every year that they do, whether it's this one or something else, so that we're continually learning and growing. And it's part of our workforce development to be doing those things. So I'm not sure what the nurses are going to choose to do, but they usually do a training in August in Helena that they like. And then Jesse will most likely do something ICS or FEMA related for his training, but that hasn't been determined yet. So Rochelle is our behavioral health coordinator, and she and I were invited to be on a panel at the public health conference in Billings in April. So one or the other of us will serve on that panel in April. And it's highlighting the near-term initiative work that we're doing and that behavioral health funding. So we're moving forward with that, and I'm really pleased with the work that Rochelle's doing. Her connections to the community make a big difference in how fast we've been able to move this forward. And so we generally have a weekly check-in together, and then we have a monthly check-in with our partners with the grant, and then we have a monthly training with them. So we're doing quite a bit of work on that. We've got some ideas for some summer events around the behavioral health funding. One of them, and kind of backward a little bit, Rochelle's been doing some key informant interviews with some folks in our community, throughout the community, trying to get some, feedback on what they're seeing with behavioral health needs and what they're wanting for behavioral health support. And so from that data and information, we're trying to build some of the strategies for what we're doing. And one of the ideas we had was to use some of the local artists to bring people together to teach some art classes that would be intergenerational. And then the work that's done with that would be displayed at the September Art Music Festival that we already hold in the park. Combining with other things we're already doing will help us create sustainability and take some of the work off from us to do an event. We also will be participating with Near Term Initiative work in the two health and safety fairs we're doing in the schools. So Whitehall has invited us to come April, I think it's April 22nd. And they want to expand it from just their junior high and high school that we did last year to their whole school. So we'll be doing a whole school health and safety fair for them. They have about 400 students. And then Jefferson High is having us come the week before on the 15th. And we'll just do the high school there. Similar to the activity that we did last year. It fulfilled our FICMR prevention deliverable that we need to do every year. We did it around mental health, around car safety, seatbelt safety, those sorts of things. So kind of addresses some of those things we've seen in recent childhood fatalities. So it'll be interesting to see what happens with doing a K-12 health and safety fair. But I know Whitehall has done that in the past. Pandemic, they would do a health and safety fair that the community organized in the community center. So we'll see how this works. I think it'll be fun because I like littles. But that's another project that we're working on right now. Jesse and I attended our multi-county FEP meeting last week, and he presented his go bag that he's done, the 72-hour pit pack to them. There was a lot of interest in that. He also showed them the little trifold desk emergency plan that he's done for safety, and was asked to present that for a FEP meeting. Our state partners were there and asked him to present that. So good work being done all the way around. I'm not sure if you have any questions for me, but
I don't think so.
those are some of the projects we're working on.
You got the
And the
building
building,
inspection.
yeah.
It's falling apart. We're gonna have to ask for less. We're gonna have to pay less for it.
Maybe they'll just, ask us to.
It surprised me that the things that came up in that, but
Yeah, I was a little surprised when I looked through it too. My office was in there.
Yeah. Yeah, you said it wasn't an office.
It isn't. It's a closet.
Yeah, we already knew it was a closet.
Yeah, we defined it a while ago.
No heating or air
So.
conditioning in there. It's just a hole in the wall.
Yeah. I even more than that, what I worry, because I have a fan and a heater, I can control that part of it. And I have an air filter, but there's no window to escape from.
Yeah,
I have
sure.
one way in and out, and I always think about that. It's like,
there is no escape.
there is no escape. I'm kind of stuck there. So I haven't located the floor plan from before. I know you and I talked about that.
I think I have it on my email.
If you've got an extra, I
We
would
have
take
it.
it. I think when we did our remodel, we've still got some stuff in the shed that we've got to go through, and it might have ended up in a file box out there. So I don't know what next steps are, what your time frame looks like with the whole building thing, but
We're waiting on appraisal right now. Once we get that, then we'll probably circle back with the board and make sure all is well. Then we'll have a public hearing to just get the public's input on us actually acquiring that building. Just to see if there's anybody that's for or against it or whatever. If it's crickets, which I think it will be, then we'll probably move forward with a formal buy-sell agreement in a county commission meeting to formalize the sale of it.
well, it sounds positive.
So we're probably at least a month or a month and a half out before we're,
I would say,
but it would be good to get that get that engineering drawing and you look it over again, so we can get an idea if that's still where we wanna go, or if we wanna modify it a little bit, or.
Cause I really think this is your chance to look into the future of what else you think should be a part of that.
Yeah, and
Whether it's mental health or some type of dental stuff or physical
Whatever we do.
therapy. I mean, we might not be able to do it all, but
no, but we've gotta look at what
we might
can
as well
do.
look at that while we're
Yeah.
doing it.
Well, and to make it a little more sustainable in an emergency too, or things I'm thinking about. But you're right, I think there will be modifications from what we were looking at 4 years ago, because we didn't even have the prospect of the whole building then, and we also didn't have environmental health in our building. And that is a priority we do need to address, is, what we do to accommodate having environmental health there. And one thing we had the conference room that I want on our side in the original plan. And I'm wondering if it's feasible to do conference room on the other side, which would give us more space for environmental health or mental health, or if we don't have a conference room on that side. And it would be similar to this, where you'd have an outside entrance and a, way to block it from
Right,
coming into the rest of the building. But I don't know how much of that ambulance bay area the medical side needs. They're spread out in it now and they use parts of it, but you can see from the photos, there's also a lot of space, so maybe it could be,
sectioned off or
yeah,
something. Yeah, and we need to figure out who to talk to over there as we move along with this project, if there's any needs on their side as well. And I don't know who I guess I'll get a hold of Christina over there and say, who do I talk to about sitting in on some of these meetings when we're designing
think
this
it's
building?
Out
What's
of
that?
Butte. They're out
Yeah,
of Colorado,
and-
but I
and-
think
yeah.
she has.
But there's
met
gotta
with
be
them.
somebody local here that knows the runnings of
And
that.
I think that's out of Butte, but I'm
That
not
office
positive.
and-
well, they have a building manager that's from Butte, from St. James IHC over there. The person that's handled the contracts, you're right, is from out of state, and I think it probably is Colorado. I think her name is Terry Kuntz, which is odd. But
Yeah, I think that's right.
yeah, but I mean, another goal is to keep them happy and to
Yep.
keep them there. So I don't want them to feel like we're coming in and taking their space or
Right,
rearranging what they need, because that's not the goal.
right, and I mean, I think that there's probably, we were trying to do this with minimal funding on the basics of what you need. Now that we have fairly good funding, we can look at this all new. I mean, the only constraint we have is the space we have on the ground, so
Yeah.
we need to go farther into the parking lot. I think I've ever seen 3 cars sitting in front of that building ever.
Or is that an actual alleyway on the other end of that?
It is. One thing that worries me about that parking lot is because it's shared with the library and us and the medical, there are times when it's a messy little parking lot. And I think there maybe needs to be some sort of a right away, if you do need to bring an ambulance in, that they can
Mhm.
get in, around and out.
Sure. Yeah, I
Um,
don't think we'd have to take up the whole parking lot, but I know we can encroach on it farther than the original plan.
Right.
If
I
we-
think we can move forward.
Yeah.
And that was what we were gonna do on our side, but if we do conference room on the other side, maybe, taking a little bit of their space, but moving that forward too.
Yeah,
And then that would still give them space, but
Mhm.
we would have that conference room out
and
front.
maybe they have all the space they need. Maybe they're plumb happy and would be glad to.
They
get up
may
there.
be.
Who knows?
I
We
don't
We
know.
just need to talk to them. And see.
I know that Ellen moved her office because they had the providers all in that one back office.
Mhm.
And she moved into a separate space that used to be Gus's PT space.
Okay,
So, but there's room in that office too. So I think with a little bit of rearranging, they could still have enough private office space. But they also do a treatment room in the ambulance bay area.
okay.
But I've been in treatment rooms that are a lot smaller than that one. So I think
Sure.
it could be condensed, so.
Well, we'll figure that out. I'll make a note to get that current plan over to you so you can take a look at it. And then we can
And Leah did reach out to me last week. She wanted me to write a letter of support for another grant she's working on for Cottage 5. So I'll try to get that done for her this week.
Sounds good.
Yeah.
Sounds good. Do we want to talk to her about that? You want me to?
Yeah. Where, I missed the health meeting because I was at Mako and Billings,
Yeah.
but where did it come up about the posting for a sanitarian again? And why is,
So my memory of that, Craig, is that Christina asked for the sanitarian to be posted again, that position, because we don't have one. That's my recollection of the meeting.
and that happened during that meeting?
I
'Cause it's-
believe it happened in the one
It's
before,
our
and then it was
understanding
readdressed
that-
in this one.
And Corey can correct me if I'm wrong, but it's still posted out there. It's just not, we're not paying any money to post it somewhere. Like Indeed, that gets us some. It's a lot of work for what we get out of it, and it's expensive. It's not too bad in our local papers, but you get outside of here and
Oh, I
it's pretty
know.
expensive.
Even ads in our local papers add up. So I guess my question is, the University of Montana's public health school has a public health job board. Is it okay for me to ask them to put it on that job board?
I think it's okay. I think we're just wondering what's happening with the contract that's prompting us to do this.
Well, my understanding with that is that as we approach spring, which we're almost there, that an RFP would have to go out before, because it wasn't an emergency contract with our contractor now.
And Steve's checking into that because I think Van said the law changed and we don't have to RFP the contract for a sanitarian.
Oh, I don't think
That's
there's
what
that many out there.
That's what he said.
And honestly, my preference is to keep the one we have, because
Mhm.
it's gonna be, that much further ahead to figure out the kinks than to
Right.
start with someone
Right.
else. And I know Van has been pretty fair to us, like, I know the other day he stopped by and I was talking to him and he said he was going to Teton, and he said, yeah, that lets me, if I stop here, I can split costs between both your counties, so that neither of you is paying
Price and-
full price. So I think they're pretty mindful of that, but
And I think so too. He talked about that when we had the meeting here with him.
yeah. So I think the goal is to have a sanitarian for Jefferson County,
It would be nice, yeah.
so, putting the word out that we're looking, I think is a good thing. But as far as, but I guess my remembrance is that we talked about needing to do an RFP in the spring. And that in order to do that, there's a certain amount of time you have to have it out, so we would have to be looking at that for the contractor. But then I don't know how the whole sanitarian position,
And I
hiring.
think Steve's
fits
checking into that. He's
into
gone
that.
this week, but
Okay,
he said, cause I think Van was sending him that information. That was what I got out of it.
okay.
So maybe we do, maybe we don't. But
So I guess I'm more than happy. I have a contact at, that does the job board in Missoula. And I'm more than happy to say, will you put our ad out? I mean, we probably got the one we did last time. And they had it up there before. I know they did. Kelly told me that I could share it with them. But I don't think it's on the board anymore.
Yeah, when we lost Megan and we advertised and advertised and advertised, and we finally had to go to a contract provider, we kind of agreed that we would keep trying to get a sanitarian, so every so often, so we're not gonna spend the money we spend on advertising for a sanitarian year after year after year, so I think we probably quit the paid advertisement for a while, but it's probably a good time to put it back in there just to see if we get any bites again. So if we can kind of
Yeah,
go for a little while, see if we get anything. If we don't, then stop for a while, then start again. We're gonna talk to Kelly about it, but we don't wanna just keep it up all the time or nobody looks at it.
well, it seems to be on Christina's radar.
Yeah,
Which, you know, the Board of Health helps manage health things, but it's the commission who handles employees, so I'm not
Yeah.
sure where the lines are with that.
no, and then we use it, obviously, we use the health board for helping us make decisions. So, I mean, if it's important to the health board that we keep trying to get a sanitarian, I mean, I agree with that.
No,
I would
I
love
do
to get
too.
a sanitarian in here, even if it's a part-time person that we can use a contract on the side, or, that's what Megan was doing, so.
Well, even when we had Megan, we still had some
Yep.
contracted services. There's
Yep.
just a lot of sanitary
Yep.
work. Yeah, so let me know if you want me to contact the job board. I'm happy to.
Talk to Kelly, I think anything that's free,
Okay.
put it up there.
And I'll just tell her that anything we can do that's not costing us a bunch of money, we
Yeah.
can do.
No,
She just heard from Molly and she asked me if we knew about it and I said, nothing's come up that I know of.
so I think Christina directed Molly as the board secretary to reach out to Kelly is what I remember from the board
Okay.
meeting. So I think that's where the channel went through.
Do you
I
think we
will-
need to have another kind of get together with the contract sanitarian and everybody that's working together that way, like we did a few weeks ago?
Yeah.
Just to
I
see,
think we're
you
good.
think we're working
I
okay?
think we're okay.
Once we get all the documents together where you guys know where they're at, and
Yeah.
they can get to them, I guess.
No, from what I see, there's good communication between Van and Molly.
Okay,
And it was Delilah that came, Van's
Mhm.
daughter. And Jim is handling certain things and he sends me a weekly report that we are filing. So we've got documentation of what's going on with complaints and truck wrecks. And I know
Okay.
the dispatchers called me a couple weeks ago and said there was a truck wreck. And I said, that needs to go through the environmental side. You have the phone tree. Jim's the top one. So then they called Jim and he took care of it. So I think everybody's knows their role and they're doing it.
Okay,
good.
I think we're okay. I can't see bringing Van in and paying him money for the meeting.
just another, okay.
Yeah,
All right, well, if you hear anything that Molly's having problems with him or anything, or vice versa. that we
yeah,
need to-
no, at our weekly check-in, I check in on environmental health too, so
Good,
I think we've got things, and I know she sent out an email to you guys about who was signing the environmental health claims, so I think it's all worked out.
working good, okay.
I think it's as good as it can be.
Mhm.
The data I got back from the state last month said that there are only 42 working sanitarians in Montana. And we know how many are at DPHHS.
Yeah.
And then we have 7 big counties. How many does that take?
Yeah.
It doesn't leave very many.
No,
For the
little
other,
county.
And
you
that's kind of what we were getting at is nobody can find a sanitarian.
No, I think we're gonna have to
from what
find a
I've
model that works
seen.
like what we're doing. And that's why I just assume keep the contractor we've had. We've worked through the
The
kinks,
bumps, yep, yep.
Yeah,
if we don't have to put out an RFP, I guess we'll have to decide if we wanna do that just for our own.
I'll
The only thing that I wonder is, how long will Jim do the interim work he's doing? I think he's very willing to help and he's very passionate about public health and he's very knowledgeable. So he's a gift, quite
Right,
honestly.
absolutely.
I just hate to wear him out. I
Yeah.
mean, one of the things they talked about in the health board meeting was increasing his stipend.
Mhm.
And I have some budget right now that we can do that. Cause I usually put a little extra in that. I didn't pay for some other things out of it that I usually do. So next fiscal year, I don't know. So we may have to look at how does environmental health budgets, pay for part of that contract.
Right,
isn't there some money in there possibly to
environmental health,
pick some of that up
oh, I'm sure, cause we're saving a bunch of contract.
for him? Yeah.
Yeah,
So that might be another option.
And that was what I said to Christina when she brought that up, is I said, I'm more than happy to pay Jim whatever we need to, because he's Wonder Man
Yeah,
for us.
he is, yeah, he does everything.
But I said, I only have a set amount budget that I can dedicate to that, but. You know, if we're increasing his contract due to his environmental health work, then maybe some of that money
Yeah.
comes out of,
And I think that there's money in there we can hit,
yeah.
but
So he's getting $1,000 a month from my budget.
Right.
And, you know, there's about another 350 a month that could come out for this year. But if we're gonna keep paying him that, then there'll have to be some wiggling somewhere.
Sure. Yeah, we gotta figure out how to formally do that. I don't know. That might be a Steve question there, how to change the. contract.
I think what they did is they approved the contract as it is, so the $1,000 a month. And then they were gonna send it through Steve to look at an addendum to that contract to increase his fees
Stipend.
until we have a sanitarium.
Okay.
And then it would go back to the 1,000 when he's not doing that other
Doing
work.
that duty.
That was what was discussed,
Yeah,
so
that would be great.
that would be something, a Steve question for where that is.
And figure out how to do that.
But my only concern is what comes out of my budget. you know,
Yeah.
so, starting to think about that already again.
Well, like Craig said, we can offset it with the sanitarian budget, because I know we're not paying the contractors as much as we're paying Megan monthly. You know,
No,
so
I
we're
think
saving
that's
money,
reasonable.
you know, and he's doing a lot of the work, so it's only fair that he gets
Yeah.
gets something for it,
Yeah,
I think.
no, he's worth keeping as long as we can keep him for
Yep.
sure.
Absolutely.
I've had 3 health officers while I've sat in this chair, and
Yeah. He's Superman, yeah.
he is Superman, so,
Yeah, we appreciate him.
yeah. All right,
Very good. Thank you, Pam.
That's
thank
good, thank
you.
you.
I appreciate you guys, thanks. Have a nice afternoon. I hope you don't have to sit in here all day.
We're sitting in here all day.